Danie, so lovely to see you again.
Indeed.
In fact, it was only just a few short weeks ago we were in New Orleans. Or when I came through immigration and said New Orleans, he looked at me and was like, "Oh, Nolans." So I have to get that. But at the MAPS conference, which went incredibly well, I think the number of people who came and the sessions were fabulous, weren't they?
Indeed, indeed. There were a lot of people. I think the final count was about 780.
Amazing.
Which is fantastic. I mean, there was a period of time when we thought 500 if we're lucky, and then it was 600, and then it was 700.
I know.
So very happy, and obviously people are really keen to get together and, you know, speak to human beings rather than avatars.
Right. That's right. And some people were meeting their own colleagues face to face for the first time in that meeting.
Absolutely.
So no, it was good. And now we've got Paris coming up as well. So
we have Paris coming up. I think it will hopefully be similar.
Yeah.
You know, COVID depending, the numbers are still quite high in Europe, but let's see.
Right.
It's a good opportunity for people to get together and share learning and learn from each other. So,
of course.
Yeah, brilliant. That was a great time.
It's something that MAPS does really well, actually, is getting together people who are like-minded, who want to make a difference in their organisation and to the patients that they serve. And they're prepared to come together to share best practice, to find out what's good current practice now.
Absolutely. And I think it's one of the key things about MAPS is the community building, right?
Yeah.
Apart from the knowledge, apart from, I suppose, looking at strategy, where we're heading as a function, but that community and sort of shared learning, and not being fussed about people working for different companies, because there's no anti-competitive thing happening, right? This is about skills, capabilities, what's the right thing to do, and learning from each other. So that's brilliant.
And I would agree with that completely. Is if, you know, all ships rise in a rising tide, right? So if we agree, I think you and I agree, that if we invest in the skills and capabilities of professionals in clinical R&D and in medical affairs, actually what is going to happen is everybody is going to benefit, regardless of what, you know, the name on your badge as you come in the building. That becomes irrelevant in this moment, I think, when we're talking about benefit to patients.
Absolutely, absolutely, fully agree. And I think that's, of course, the reason why MAPS started. So I've been involved for, well, shortly after it got together from 17, and I'm currently on the board. And that's indeed what we want to do, is to elevate the profession for everybody, so that people are able to take the rightful place within pharmaceutical industry, but also outside, because we've got many more stakeholders now than before.
Indeed.
So so we have to continue learning as well.
Yeah, and it is actually the topic of our conversation today. So I'm really delighted that you've invited me to your office. Thank you so much. I appreciate that. To continue the conversation that we had in our panel discussion when we were at MAPS together, and you referred to it earlier about taking a leadership position on strategy in the organisation. So how can we continue to invest in the skills and abilities of medical affairs professionals to take a leadership position on the strategy for their assets going forward, in order that more patients will gain access to and benefit from the best medicines for the right reasons. And for me, investing in everybody's capability, regardless of therapy area, geography, region or company, is a passion of mine, and I know it's a passion of yours as well.
Yeah, absolutely. I think that is critical. We need to remember that, you know, we're in a commercial enterprise.
Sure.
But it's a very specific type of business. It's a medical business. It is about science. It's about the data. And we need to understand what that means. Recently, actually at the MAPS meeting, I had a conversation with colleagues as well about in the olden days when I joined many moons ago.
Me too.
it was, you know, we need to get this product through the regulators, right? FDA, Europe, wherever. And that then changed to, actually, we need a reimbursable file.
Mm-hmm.
And I think where we're now is, what is the value to the patient?
Yeah.
The patient's family and the patient's carer.
Mm-hmm.
And it doesn't mean the others are wrong. We need
Mm-hmm.
them as
Mm-hmm.
well.
Mm-hmm.
But we do need to move on. We do need to understand what the end game is.
Yeah.
And for that patient benefit and clinical perspective, if medical does not help to get that to the right level, then what's the point?
Agreed.
Right?
Agreed.
Dare
Yeah.
I say, then just you could outsource it to anywhere else, right? So medical in the company has to have that job.
Exactly. And to be able to do that well, medical affairs guys have to be able to speak and understand the language of commercial. So we're not
Correct.
saying promotional, we're saying commercial. Because if you think about the value, you've just talked about the value of medicines, that means, of course, efficacy, of course, safety, of course, a deep understanding, not just of the data of that medicine, but the totality of data available in that therapy area, in order that the right medicine or device gets used for that patient in the end. So if you say medical affairs have a strategic role to play in the asset, maybe the asset shouldn't be the brand, the asset should be clinical practice. So taking all the clinical data, the safety, the efficacy, the cost, because naturally there's a cost, which equals value, and then translating all of that so that clinical practice is positively affected. That
Yes.
is the unique role, I think, of medical affairs.
Absolutely, fully agree. And I think, you know, in modern times, we just cannot invest money in a Me Too product anymore. We have to be able to get products to the market that really, truly makes a difference, that fills that unmet need,
Yes.
right? I truly believe that is important. So, to your point, that by default then needs to change clinical practice, right?
Yeah.
Obviously in an appropriate way, you know, through, you know, whatever is needed in a specific country to follow the right process. But if we have a new product on the market that truly fills that unmet need, closes the gap, so to speak, then of course it should make a difference to clinical practice. Clinical practice should change.
Yes.
So that should be the end point, right?
Yeah.
The aim, if you want. Because that's what's going to make a difference to patients, their families, and to their carers.
That's the true measure of success, isn't it?
Absolutely.
So tell me, Danie, what do you think currently is missing? So if we agree that in medical affairs we understand the pivotal clinical studies, we understand the data, and we understand the unmet need, why are senior leaders in medical affairs perhaps not taking the leadership position that we think they ought to in the whole strategic planning process? What's going on?
Wow, that's a multifactorial question, I think. So I think in the first instance that it is ingrained in the industry to primarily look at short-term results, financial results, right? 12-month period, doesn't matter when it starts and ends, but a 12-month period. Medical, it's very difficult to do that on a number of different counts, right? So first of all, evidence generation very often takes much longer than that, right?
Sure.
Of course, it depends on the disease, but it takes longer than that. Analyses needs to happen, publications, how do we disseminate the data? That's very, very seldom a 12-month period.
No, that's like 3 to 5 years out, isn't
Exactly,
it, really?
right? So that's the one bit that is automatically a tension, if you want. I think the second thing is this notion of being human, where you end up with either or rather than both and, right? So we need to get better, I believe, in the industry, not only medical,
Yeah.
to understand the short, the mid, and the longer term, and to
Yeah.
talk about all of those sort of in together, right? But it's still the default is to the short-termism. Are we going to make it? Is the stakeholders going to be happy? What's the share price? And And it's not unimportant, but we have to keep the eye on the patient. And of course I'll say that, right? Of course I'm biased. But again, we are a business, but we are a very specific, special type of business that actually works with human lives and human well-being.
Yeah.
So we have to think different to just any commercial enterprise.
Yeah.
I think that's one of the big things. The second one, I think, is maybe just the history. It's difficult for many people who've grown up when they joined 30 years ago. It was very often the medical services department, right?
Yeah.
People had to do what the commercial leaders told them what to do, right? So they've grown up, and it's not everybody who can, I think, make that transition always to say, okay, enough, stop.
Yeah. Yeah.
This is what it needs to be. Here's the reasons. And then that gets back to the comment you made about the commercial language, right? To understand, how do we talk about scientific data in a commercial way so that we can get to the both and conversation rather than either or.
Yeah. And I think you've hit on something there about investing in capability, because are our medical affairs professionals smart, intelligent, articulate, well-educated, passionate, committed people? Yes, yeah, we can agree on that.
Yeah.
You don't go into this role not wanting to make a significant
Correct.
difference to patients' lives. And often my colleagues will say, I feel like I am the voice of the patient in my organisation, and I say, fantastic, you should be, absolutely. But then you need to learn how to speak in the language of commercial, because we are in a commercial organisation. And if you want to have the and both conversation, the 1 year and the 3 and the 5 year conversation, and if you want to be a leader in your organisation in affecting how successful that product, that brand, that device is, then you have to learn how to do all of these things, like managing across your matrix, having difficult conversations, learning the strategic planning language. And are you
understanding
ready
the
to do
value
that?
of the short-term P&L as well.
Yes, yeah.
Because we can't ignore that.
Yeah.
We can't ignore that. So that, I think, is a really important skill, not to be ignored.
And I think when talking to very senior leaders in pharma, including CEOs, they will say that they see the external face of their organisation talking to external experts as medical affairs, because external experts want to have two-way, fair, balanced, transparent conversations about the data in order that they can make up their own mind about their clinical practice. So they want to have a conversation with somebody who really understands the data, understands the value, and understands the unmet need and what it is that they're facing in their world, their hurdles and barriers and opportunities. And they want to have a conversation with somebody in medical affairs. So I think very senior leaders see that, and I wonder if our medical affairs professionals are ready to step into that space of being the external face of their company.
I think you are definitely onto something, Suzanna. So the scientific exchange or scientific dialogue, whatever you want to call it, I think is incredibly important. Now, let me also say that in my almost 30 years in the industry, I've encountered many, many commercial people with a deep knowledge of the science, right? So I'm not suggesting it's only sits in medical, but externally, there's a credibility that comes with medical rather than with commercial. And we see that especially in patient organizations. So of course, the next big MAPS thing, as you sort of alluded to earlier, is Paris. So the EMEA meeting for MAPS, which is happening middle May. I do hope we have a lot of people there. The program is going to be fantastic as well. There are some of the topics that we know worked really well in New Orleans that we're going to sort of bring back, different role players but same topic. So that will be fantastic, and I know you guys are going to be there as well, right?
We are. I hope you're going to come to our coaching workshop, Danie.
coaching, then my ears go like this. So yes, I will be there.
Excellent, excellent. Well, I
there.
really look forward to seeing you there. And thank you again so much for your time, as I knew it would be. It was an absolute pleasure speaking with you today.
Thank you for taking the time. Really appreciate that. And thank you for what Amplity is doing for medical affairs.
Thank you so much. Lovely to see you.